It's your village girl, Dr. Dakalo, and welcome back to the Doctor's Corner podcast. This is a medical podcast where we have medical conversation. We have real conversation. We invite experts to come and give us advice on different parts of medicine. And I'm still your host, Dr. Dakalo. And the topic for today is one that I myself am very excited to know more about it, which is corporate medicine. And there's no other person that we could have than the guest that we have today is Dr. Mela, a doctor that is known for corporate medicine everywhere, right? Dr. Mela, welcome to the podcast.
Thank you for having me. I'm happy to be here.
I'm really excited to have you. I honestly just said you're known for corporate medicine because that's what you are. The brand corporate medicine. If a young doctor in South Africa Googles corporate medicine, you are the first person that comes up. Mm-hmm. Because you have taken time to share with us what corporate medicine is and what are the different parts, right? Mm. And I'm sure from the short videos that we've seen, there's other things that we've missed. But mostly, we want to know who is Dr. Mela. Mm-hmm. Please introduce yourself and tell us what do you do, what you're about, what are the nice things you like?
Okay. So my name is Dr. Mela, also known as Dr. Mela on social media. I am a mom, I'm a wife, I'm a medical doctor by profession. I am very passionate about corporate medicine. That's how you know me. Mm-hmm. I also ran an award-winning NGO that I founded, I think about 10 years ago now. And that was about empowering young women all over the world. So I mentored over 450 women from all over the world and it won quite a few awards. And I think I'm just passionate about corporate medicine, but most of all, I think I'm passionate just about life.
Yeah. And I think sometimes we don't tell people that the power, when you are sitting, you are unable to see the power that you hold. Mm-hmm. You are one of the people that have changed people's perspective on life, have changed people's direction in career, right? And especially people from where we're coming from, traditionally, we all knew the mainstream of medicine. I go work at the hospital, I go work at the clinic, right? You go specialize and do all those things. But we were never opened to other spheres of medicine. We never knew that you could work as a corporate. And why are doctors doing corporate medicine, right? So please just tell us, what is corporate medicine and what is it about?
Okay. So I like to break it down into very simple terms. Corporate medicine is basically the non-clinical parts of medicine. And it's called corporate medicine because you're working in large corporations. It's really that simple. Okay. So I break it down into working in industries. So this could be in managed healthcare. It could be in pharma. It can be in occupational health. It could be in consulting. It's areas that we don't know about because we're not taught about it. Even when we do rotations at medical school, it's not something that we are exposed to. So myself, I work in managed healthcare, which is your insurance, your medical aids. But there are doctors who are working in research also, doctors who are working in pharmaceutical companies, your Johnson & Johnson, your Aspen, your Cipla's, doctors in consulting, your McKinseys, your BCGs, your PwCs, doctors who are working in occupational health, so usually in the mines and so forth. So that is kind of like the word corporate medicine. It incorporates all of that. But it's actually a big world where doctors work.
You summarized it in a way that I never thought. I just thought, okay, you guys go to the office, you discuss only medical aid stuff, right? How do we fund whatever the disease that this person is coming with? Are we rejecting the authorization or not?
That's what you guys know us for.
Yes, that's what I thought, that medical doctors, their contribution is that, right? And when you talk about insurance, which is what you're doing now, is when you're working for a medical aid, what exactly are you doing? Are you just saying, guys, you can fund that, you can find that, or you can find that, or is it more than what we think it is?
I think there's definitely more to it, right? So it depends where in the insurance you are. Okay. So let's give an example. Insurance is many things, but let's talk about medical aids in particular. Mm-hmm. So in a medical aid, there can be the clinical side, which is where I sit. There can be the risk side, and maybe even the research side, or even the health and wellness side of a medical aid. So it depends which part of the medical aid you're in. So if you're in the clinical elements like myself, you'll find that we are working with not necessarily claims, but conditions. So if a member is sick and they're on the wrong plan type, for example, for what they're asking for, that kind of stuff is the things that I look at. Or if it's rare conditions, rare diseases, cancers you've never heard of before, and you want the medical aid to make, this exception for you. That is kind of where we come in. But then there are also doctors who are working with coding and claims. And you would know about that because as a GP, you're always sending us your claims, right? And then those doctors are looking at, are you coding properly? Because at the end of the day, it's risk mitigation. So we have to make sure that what you guys are sending us, number one, is true and it's factual. So if a child comes in, like when we met when Ori was sick, and you obviously submitted that to my medical aid and you had codes attached to that.
Yes.
So those codes, they have to reflect what clinically you're telling us when you submit your claim. Doctors sometimes tend to unbundle claims when they're doing operations and code for more things than what they're using. That's why you need a doctor on the other side to say, actually, you don't need 20 swabs when you're doing a C-section. Maybe you only need 10.
Yes.
So that's another part in medical insurance.
Okay.
Then there's the wellness part, right? Every medical aid, I know there's a wellness element to it. Doctors there are studying you as a human and your disease and how to better make you healthier so that you cost us less.
So you don't get sick.
Okay.
Mm-hmm.
You need a doctor to do that because if you're hypertensive, for example, I as a layman won't know what hypertension is.
Yes.
But as a doctor, I will. And I'll say, okay, if she takes her antihypertensives and she walks 5 kilometers a day and she drinks 2 liters of water, how am I going to reward her? Then I reward you for that and then you stay healthier. If you stay healthier, you cost us less.
Oh, is that why the other big company has that gym thing that you get rewards for?
Yes.
I just thought, it's just another way of them making money. It's a way to save them money.
It's how we save money. The less sick you are, the more money we save. And this is, of course, across every medical aid. That's why every medical aid has some wellness element to it. Because for us, it's what we call risk mitigation.
Okay.
Right? So there are ways in which we mitigate risk in terms of how expensive are you to us. The more expensive you are, the more we can't afford you.
Okay.
But if we make you healthier, you're less expensive. And so we'll reward you for that. And rather than treat you in hospital. But it's also good for your health.
Yes, it is good for your health. It's good for us, but it's also good for the companies themselves.
Yes, definitely.
I am a GP, and I think right now you just made me realize that sometimes because the system that we're using, right, doesn't have the code. Oh, I don't know, because I'm still new. I don't know what's the exact code for maybe a specific rash or a specific procedure, right? I just go and say Z00.0. But then it means that my diagnosis makes no sense with the things that I've done.
100%. And then we decline it. And then you guys get angry at us and you're like, oh, you guys just don't want to pay for anything. We're like, no. So for example, when you give us a code, like you said, that's incorrect, right? We reject that because for us, it doesn't make sense. The clinical picture and what you're coding for doesn't make sense. Then you guys get angry at us and you say, oh, medical aids don't want to pay for anything. And that's why I think it's important for all doctors to actually take coding courses.
Yes.
Usually it's your practice, are they called nurses or practitioners? The people who sit in the front.
Yes.
They usually know how to do the coding for you. And so I think when you, as a GP, it may be a bit more tricky because it's so broad, the amount of diseases you see.
Yes.
But specialists, it becomes easier for them because they're going to code the same thing over and over again.
Yeah. Okay. I'm going to do better so that I get paid. Because I think that's important, right?
But then don't you just resubmit the claim?
Well, it's not nice when the claiming clerk comes back to you. Doctor, don't do this all the time. Okay, we must resubmit. We must do. It's not nice, and also the delay in payment is also not nice. You see, so I used to just say, I can't see where my grains are. Z00, okay.
Oh,
I gave this,
really?
and I didn't know better. Now I know that it needs to make sense. It's like my notes must make sense with the coding that I've written, right?
And that is on the CMS website, actually. They give you all the ICD-10 codes for you to code with, and that's free. Yeah.
Well, I've learned, and when you qualified from medical school, right? Did you know that this is what you wanted to do?
So when I was in 5th year, we did a public health rotation, and they took us to like a small town in Mpumalanga, and they were teaching us about public health medicine, which is more like your primary health care and researching on disease burden and stuff like that, right? And then that's where it clicked for me that this is the niche I belong in. And I was convinced that I'm actually going to be a public health specialist. So when I was in my ComServe year, I started applying for Reg Time to get into public health. But then I was like, I'm not going to be that statistic that is unemployed. So I applied for everything, but in things that I want to do. So I applied for jobs in corporate medicine, because I didn't really know what it was, but I just like see it, like, you know how we all have those LinkedIn accounts that we never use, but everybody's in LinkedIn, so maybe you should have an account. And then I just see jobs for doctors there, and I'd be like, what is this about? And back then, when I would Google, nothing would come up. And they'd be like, they're looking for medical advisors, medical doctors. My husband was like, why don't you just apply? Like, you never know, right? It could be an avenue, because I knew I wanted to not work in the hospital. So for me, I'm thinking, okay, I'm going to be the next Minister of Health. That's honestly what was in my head. So I was like, so I have to become a public health specialist and then go work at the government and all that stuff. So then that's what I did. I applied for a lot of jobs outside of the clinical sphere.
Okay.
And when I did that, that's kind of how I stumbled into corporate medicine. It was one of the many posts I had applied for. Went for the interview and they took me, and that's how I ended up here.
So then I have a follow-up question. It means that because you're saying you just applied and you're just fresh from ComServe, did you like have any other certificates that you did so that you can qualify to be in that space?
So I started researching about the non-clinical spaces that I was finding on LinkedIn. So for example, research. Research, they said it would be advantageous to have a GCP certificate. So I went and I Googled what that was, and then I saw that VIT offered it, and I did that. So basically, I would just look at the job spec. The job spec would be like, oh, you need to know how to use Microsoft. So then I went on Coursera and I did a Microsoft course. Basically trying to make myself more attractive.
Yeah, okay.
But there was no big postgraduate diploma. I didn't have any of that because I was just fresh out of ComServe. But I did what the job spec was asking me for. But my job at the time, when I started in corporate, they wanted someone who was actually a primary, what are they called?
Primary healthcare.
Yes, a primary physician.
Oh, okay.
Yeah, a physician. That was advantageous for them. So they actually wanted a specialist, a FAM-med specialist.
Oh, okay.
But then I still applied for the role anyway. So I didn't have the qualifications.
Yes.
But I was like, you never know.
God qualifies the unqualified.
Exactly.
So let me just be the one.
Yeah. Yeah, and that job, actually, my husband applied for it for me. I didn't apply myself. It's only when they called me and I said, can you send me the job spec? Because I'd never seen it before, right? And then it showed there that, oh, you need to be a FAM-med specialist. And I was like, oh, chances are I'm not going to get this job. But I still went for the interview. Yeah, and it turned out fantastic.
It's amazing that you just went and said, okay, I'm going to enter this room. I know I don't qualify. And the Bible says that faith without works is nothing.
Exactly.
You can't just say, I'm going to be employed and you sleep at night, you know? And you said you applied for a bunch of jobs. You didn't say the number.
71 jobs that year. Because I told myself, God, I'm not going to be unemployed. And I think that's when the unemployment for doctors was starting. And I was like, no, I'm not going to be part of that statistic. So I'm going to apply. And I didn't apply for things I didn't want to do. So I didn't apply for peds and no, I applied for corporate. Well, there were some jobs that I didn't want to do, like MO. I applied for those. I applied in research, but I have the list on my phone, 71 jobs. And I can show you how many of them rejected me and how painful that was. And my husband was like, this is normal. Like corporate rejects you, like it's nothing. But remember, we have never applied for jobs before. Yeah. Internship, you just pick a hospital.
And then they just give it to you.
Yeah, you pick a hospital. Now it's my first time actually being rejected. Someone saying you're not good enough for this role. And that was actually
and your
really
whole life you have been good enough.
Yes, exactly. Your whole life you have been top 1% in everything. And now you have to change your psyche to be like, it's not that I'm not good enough. Maybe that's just not what God has planned for me.
Yeah. Yo, hi, Mela, 71.
Yeah.
I don't know. I'm probably applied for like 20 jobs. And I was just like, God, if this one is not for me. And imagine maybe I applied the 21st job, I would have gotten that one.
Exactly.
You know? But you said you didn't qualify. You got a job that you didn't qualify for. Another fact is that God qualifies the unqualified.
100%.
So just apply. Just apply. Don't be scared. Just send that CV. Someone is going to see it.
Yes.
You know? So it's going to land in... You know, my mom told me when I was applying for jobs, she said, don't pray for the people who are going to be in the interview only. Pray for the people who are going to receive your CV.
100%.
Who's going to receive your Z83 that you didn't even feel properly.
Yeah.
Like, pray for grace and favor with those people, right? And hi, Mela. 70. I'm still baffled by 73.
Yeah, 71. But I would apply like every day, like it was just another thing to me. I'd just be like applying. Like it was part of the process.
Nah.
Yeah. And I think a lot of us don't want to do the process. You just want to apply for 3 jobs and go for 3 interviews and get a job.
Nah.
And the fact that maybe that was the 71st job, but maybe that was the one that I got. So I just feel like I knock on doors all the time that I'm not supposed to be in. So
when I was heavily looking for jobs, right? I need to sit with a patient and educate you, okay? This is the disease that you have. This is why it's happening like this. You experience this. If I give you this medication, it's going to do this and this and that, right? I also looked into corporate medicine because everyone is talking about, wow, corporate medicine.
Yeah.
But every time when they post on like LinkedIn or other platforms, they always say experience. What is that experience? What are they talking about? Because Andina experience. I just came out of government. Is that the experience that they're talking about? Or?
No, most of the time they want somebody who has at least 2 years post-ComServe. Okay. So MO time, at least 2 years in private or even public healthcare. But to be honest with you, we employ people without that all the time.
So don't be limited by just seeing...
The job spec is... Maybe it's just a desire. But then you come into that interview and you have none of what we asked for, but you're the person that we want. And then we hire you. And that's what happened to me. Every role that I've gotten, even where I am currently, it's not what I applied for. They headhunted me. And I was like, no, I don't have the experience that you guys are asking for. And it just goes back to that thing of like, God will put you where you feel like you don't belong, but he knows that's where you're meant to be.
Yeah. Your current job, you said your current job, you didn't apply for it, they called you and you said, I'm not qualified. They said, no, we want you unqualified.
I had applied for a job like junior to that. I had applied to be a senior medical advisor. And then I went for the interview and then they called me and they said, actually, we want you to be the head of the medical advisors. And I said, nope. I just had a baby. I don't have what you guys are. I had to ask for the job spec again. Like, guys, can you send me the job spec? I don't know what you're asking for. Yeah, that's what happened.
Yo, hi, guys. Don't give up, guys. keep applying. Even if you feel unqualified, just go
100%.
there. You see, where I'm sitting, I'm going to be applying. The number is okay. If Mela did 71, I'm going to do 81.
Exactly.
You know?
Yeah, you should.
We have touched on 2 subjects just to get into what is corporate medicine and how do you need to qualify to get into the space. And I think we're intimidated by you need to qualify to be in the space. Now you have debunked that. You don't need to qualify for anything. Yes, you need to upskill yourself. Like,
Definitely.
For example, now from this conversation, I'm like, okay, I need to learn how to code.
I
need
to do learn how to
coding course, you know.
And there are free courses that you can do. And so I say you have to first discover what niche do you want to go into in corporate medicine. So if you want to go into occupational health, for example, get an occupational health diploma, right? If you want to go into pharma, look into maybe they need someone with research experience. Like I said, in research, they want a GCP certificate. Like, there are things that you can do that are not necessarily like a master's or whatever, but it's still upskilling yourself. Because the other thing is, you don't want to go into that interview and you know nothing. That's very demoralizing. I interview people all the time. And you ask someone, what is PMB? And they have no clue. But it's on the job spec. So in one of my interviews, I told people that how do you prepare for an interview in corporate? You read the job spec, and now you have AI. You have Copilot, you have ChatGPT. You put that job spec in and you say, give me interview questions. It'll literally break it down for you, because what we ask you is the job spec. So people, I think, overlook that. And then when HR calls you, and HR will coach you and they'll say, please go through the job spec. I think people just think we're just saying it. No, it's because what we're looking for is what we've written on the job spec.
So for you to understand what's required of
you. For you to understand what's required of you. And that's why it's important to find out what niche you want to go in, and also why. Why do you want to be in corporate medicine?
Yeah.
Is it because you're not finding a job in clinical? Or is it because you're passionate about a space there? Because let me tell you, it's tough.
It's not like you can't avoid the lines there.
No.
And come this side. It's also tough.
They are their own politics in corporate, right? And you're dealing with lots of money. These are corporations. They're not going to be gracious like public health. You can't just make mistakes that cost 2 million rand. So that means that you have to have a why when you come into the space. And that's something that I think when I ask people in an interview, like, why do you want this job? People can't answer it. And that's something that I think is the fundamental question when you want to come into corporate medicine.
Yeah. But why do you want the job really?
Yeah.
Yeah. If you're tuned in and you're watching the Doctor's Corner podcast, and I am your host, Dr. Dakalo, and I am with Dr. Mela, we're talking everything corporate medicine. And yeah, we have spoken about a lot of things before this. And now, Dr. Mela, I just wanted to ask you, right? You went on LinkedIn to get the jobs that you mentioned, all the jobs that you applied for. Someone might say, when I go on LinkedIn, it's just a lot of things that are there. Is there any other platforms or any other ways of getting these opportunities?
So I didn't just use LinkedIn, I used Google. So I used to just Google jobs for medical doctors. And then some would come up there. And even on LinkedIn, you can just type, when you're searching under the job icon, you type in medical doctor, and then jobs just for medical doctors will come out. So that usually makes it easier. But LinkedIn, I think, is your best friend. I always say that, like, if you want to get into corporate, that's where every company posts. So that should be, you make your profile attractive, because HR sometimes just headhunt you. They reach out to you. Recruiters will headhunt you. So you can make a very good profile for yourself on LinkedIn and make yourself attractive to corporate medicine, and people can reach out to you, which we do a lot of the time.
Must take my LinkedIn very serious. You know, when I was last year, when I was doing Com7, I was applying for jobs, right? I went and I updated my LinkedIn, whatever. But when I got to a point where I was unemployed, I experienced anhedonia. I was not interested in anything, right? I stopped doing that, and I still we are now almost 6 months into like me working as a GP, right? I still have my notifications and emails that come in, but like I'm so intimidated in going back and say, okay, I've started my diploma with what, and I'm doing this, and I'm interested in this, and I see everyone is updating, but I'm like, And another thing that's kind of demotivating is when you say, oh, I just acquired this, I qualified this, and you're still thinking, I don't even know what I want to do.
Exactly.
I don't know. Is this worth enough to say, okay, I have the dispensing course. I just got a certificate for dispensing. I did whatever certificate that I had. I felt like, well, it's just a small certificate. Do I need to put all those things there?
You should. I mean, I put something as simple as I have not a diploma. I have a certificate in Microsoft. And somebody else will think, why are you putting that? But it's because I know every job spec in corporate will say, be proficient in Microsoft, which just means we need you to know how to use a computer.
Yeah.
Right. So, and also when you put all those things in, when HR are searching people, it makes it easier for you to come up. Oh. So if we're looking for someone with like a dispensing, I don't know, certificate, and you have put it on, then you are going to pop up when they search, because they have a different type of LinkedIn that they use. They use a professional one.
Oh, okay.
So that's how they find you. So they probably just type things in, and then whoever comes to the top is usually who they reach out to.
Okay. So if I'm to ask you, Dr. Mela, how do I set my LinkedIn, or however the profile is, whatever platform it is that we get jobs from, what advice would you give me? Like, how do I put my LinkedIn in a way that I'm attractive? Like I can be attractive in any job, right? Because I don't think it's just about corporate medicine. It's also research. Also, you can be in a pharmaceutical company, right? What would you say to such a person that I am not on LinkedIn? Where do I start? What do I write there?
You write what you're doing, but also what you're interested in. So there's things like even just your bio, right? Where you're introducing yourself on LinkedIn. You can say that I'm Dr. Dakalo, I'm a GP at NHC or whatever. And, my interests are, I don't know, HIV or PEDS or whatever. I think LinkedIn is very nice because it actually will remind you that you haven't filled in this part. You haven't filled in this part. And all those parts are actually really important. And there are parts where, you can even like write little articles. Like I know people, for example, who have interest in occupational health. So they go to occupational health courses and conferences and they post those things, right? So it's just about creating a brand for yourself on LinkedIn of what you are and also the kind of space you want to be in. So if you want to be a pediatrician, you should see you with kids all the time, or even writing about the articles you're reading or the courses you've done on PEDS. So you create a brand for yourself on LinkedIn to suit the niche you're trying to get into.
So it's the same thing that when I was applying for certain jobs, they said that the qualifications that are related to that job that I'm applying to on the CV, I must put them at the top.
Exactly.
Right? And then the ones that don't really matter, I put them at the bottom.
But also with doing your CV, I don't encourage people to like do it yourself. There are AI tools for that, right? And that's one of the things I spoke about on one of the videos I did on my series. I can't remember what it's called, but there's like some website where you go on and it literally like guides you as to how to do the CV, and it gives you, there's an international standard of how your CV should look. And as doctors, we don't know that. So you guys give us CVs that have too much words on it, and HR has no interest in reading that. I don't look at the CVs first. HR does. Then HR then will decide these are the top 10 candidates. I mean, for us, we have like over 200 applicants for a job. And now it's the AI tool, the system that just declines people who don't meet certain criteria. Then maybe 150 will make it through. HR will take it down to maybe like 50. And they're like, okay, Dr. Mela, here are the top 50 for you to look at. But that means that if your CV from the beginning is not telling that AI tool what it needs to tell it,
then
it's
it's
going to
gonna be
reject you.
rejected. Mm-hmm.
Exactly.
So you must also pray for favor with the AI tool.
Definitely,
yes.
but also do the work.
Ne?
Yeah. All these platforms are there, the tools are there. Do the work. It's not that much. I think you pay like maybe 10 euros for your CV to be done in that standard. I can't remember. And then it does it for you. And there's a flow that HR requires when they're reading your CV.
Because I once showed when I was well, I once showed my cousins, they are software developers, right? I wrote my CV how I was told by my brother who's also in medicine, right? And then my cousin's like, let me see your CV. And then I showed her. She's like, who did the CV? I said, myself. She said, girl, just bring me this thing. Because like, what is this? What are you saying here? I'm like, oh, well, I was told to do it this way. She's like, no, let me like put it well. And I did get interviews for the jobs that I applied with that in CV. And it made a difference,
it does.
It really does, And I think from what we're just talking about, I think I'm learning so much that I'm like, when you're talking and I'm just like, okay, so I must go ask AI how to do this. Because I think for me, because I'm still in a very self-discovering or career, is it career developing or
career
like I'm
stage.
discovering myself in whatever. Because I think what I always knew that I wanted doesn't sound like it's what I actually wanted to do.
So what do you want to do?
So for me, I always said, because, okay, at first, I think my whole career was I want to do something that's big, right? That's how I ended up in medicine, right? Number one. Number two, when I was in medicine, I still wanted something that was big.
Big in what sense?
In the sense of what I'm told is big. Right? So the voices of people that I'm around made me make the choices that I wanted to make at that moment. So this year, because I was unemployed and then I got to work on my own, I discovered that I like the sitting down and talking to patients. So like, for example, I thought I wanted to be an obstetrician. Because I get to teach the mom, okay, this is how you breastfeed. Okay, when we do a Caesar, this is what we do. It's not the obstetric itself.
So is it primary healthcare then?
I don't know. That's where I don't know. I don't know
if
you're
really good at the teaching part.
Yeah, that's the power. That's the thing that I realized about myself. And like affirmation from like the patients. I said, no one has ever. I had this other gentleman. He said to me, "Doctor, please explain, what does the top number of the BP and the bottom number mean?" I explained to him, and then he left. And then he came back. He asked me a question. He's like, "What are you doing here?" I said, well, there isn't jobs, and I think I'm starting to like something like this. Do I like being a GP and doing everything? No. I know I like teaching. I like teaching about like lifestyle diseases, hypertension, diabetes, right? Like all this lifestyle, like women's health, like sexual health, and all the common things that people experience. I don't like dealing with like bones breaking. I don't like the emergency stuff, right? That's what I don't like. I don't like things that are unpredictable. I want to have knowledge that I can transfer, and I see that you're making change with what I've given you.
Though.
I didn't have a name for it.
Yeah, that sounds like primary healthcare. Because even on your TikTok, I think that's what you're teaching us, right? Yeah. And you're good at it, because I remember the time when we came, you were so nervous.
I was. And it's not nice being in that position, It really isn't nice.
And then you were like, I know you. And I was like, okay. And then
it's not nice. It's not nice seeing like your colleague or someone that you hold at to a high regard, and then they come to you and they're like, I bet it must impress,
But you told us so well.
Really?
You did. And I can't remember what I was asking for. And you're like, no. I wanted to skip the stepwise process, because I was like, are you just going to give it this? And you're like, no, mommy, we need to start here. And I loved that, because a lot of people They don't do that. If I say I want a Rossifin injection, they give me a Rossifin injection. So I think that's amazing. That's a good skill to have.
Yeah, well, I will see. I will have more conversations with you if I realize that, hey, Mel, I don't know something. Sometimes you don't see yourself, right? You need other people to tell you that this is what
to be a mirror.
Yes, so that you can like make proper decisions that are appropriate for you.
100%.
Yes, and we've had this. I like this conversation, and I know I'm gonna call you, and we're gonna talk more about it. But because of time, do you have any like last remarks, like any tips for people to know? You've spoken about how to write your CV, you need, and how to present yourself on LinkedIn, right? Is there anything else that you think is very important? As you said, you also hold like interviews for people.
I mean like people. So like if there's a vacancy in my team, I have to interview people.
But as an interviewer, what would you say to an interviewee?
So I think figuring out what is your why is very important for us. Even for yourself, you don't want to spend years chasing the illusion, like you said. You put your worth in other people's words. People told you that this is what is held to a high esteem, and that's what you did, right? Even when I was going into the corporate space, I remember one of my registrars at the time when I was an intern said to me, Mela, you can't go into corporate. Doctors are not treated well there. They don't recognize your worth as a doctor. And I was like, part of me was like, oh no. So like people are not going to take me seriously anymore. They call you by your name there, right? Maybe one person would be like Dr. Mela, but everyone's like, Mela, you're just another person, right? And so that shouldn't, if you're coming in with that thing of saying, I am a doctor and I'm in corporate and I'm different, it's going to break you. That's why your why is important. Your why as to where you're navigating your life to. You can't put your worth in titles. You can't put your worth in even degrees. Your worth has to come from within. And when you know that, it's easy for you to navigate wherever you want to go. So I always say, know your why. Why are you doing something? Why are you doing this podcast? Right? Why are you working at NHC? What is it that you're trying to discover? And I use those principles in my life, and I don't think they've ever guided me wrong. When they called me for that job, I had to ask myself, if I were to take it, why am I taking it? For me, it was God telling me that the mentorship program that I stopped 3 years ago or 4 years ago when I was finishing my ComServe and I had no capacity to continue, that was continuing in the space. I was going to have a team of people who I can mentor, right? And that was my why. And every day when I wake up and go to work, the people are what keep me. And I think that's very important for you also to discover that for yourself.
Okay. And is there any other tip that you can give someone who's like, no, I'm really interested in this, or wherever in their career and they want to make the big move of not doing the way that everyone is doing? What do you have to say to that person?
I think I'll just say, if you don't try, you'll never know. I look back and I'm like, I'm so glad I took that leap of faith. I remember even some of my family didn't understand what corporate medicine was. And they're like, where are you working? What do you do at a medical aid? Right? And then you have to explain to them that, oh, actually, it's important work and this is what we do. But I think that like if you are passionate about something and you want to go into a specific space, don't be afraid to. And even if you're the first, then be a trendsetter. Don't be afraid to knock on doors. That's one thing I've learned. I remember when I was trying to get into corporate, I would message every doctor I could find on LinkedIn was in corporate. 99% of them didn't reply. Maybe 2 replied and gave me advice that I never used. But for me, it was an act of faith. I was saying, God, I'm availing myself in every way possible because this is a space I want to get into. And I think sometimes as people, we let pride get in the way, or even like nerves. Growing up, I was very shy, very like reserved, but I had to come out of my shell and say, this is what I want.
And I'm going to go for it.
And I'm going to go for it. And I think that's what's the most important thing. You can't stand in the way of who God is calling you to be.
You really can't.
Yeah.
You really, you can feel as qualified as you are for a certain position. But if God says, awi lapo, that's where you're not going.
100%.
You know? And thank you. Like, I'm so sad that we have to come to an end. Thank you for coming and thank you for sharing. And I'm sure someone out there will be asking, where can I ask, like, if I want like more information, where can they get more information from you? And if like maybe other companies want you to come and speak, I don't know, how can they get a hold of you?
So it depends because I wear so many hats, right? So if it's for in my own personal capacity, that is through our family page on TikTok, the Muraudis, and all the information is there. The linked, is it called the link tree? Something like that. All the links are there. If it's in terms of even medical stuff, that's how you can get a hold of me through all my social media platforms. At Dr Mela _MD on Instagram. LinkedIn, it's just Dr. I think it's my full name now because I'm professional.
Yes.
Dr. Mela Mraudi. You can pop me a message. I get quite a lot, so I don't always respond. But I do have a 3-part series that you spoke about corporate medicine. That's always a good place to start.
And it's on the TikTok.
It's on TikTok, it's on Instagram, it's on LinkedIn.
Oh, I didn't know about that. I could have been trying to avoid LinkedIn. So it's on LinkedIn.
Yeah.
Go on LinkedIn and get it there. And thank you so much. I think I've said so many thank yous because I really am thankful that you're here, that you took time away from your busy schedule and being a mom. You know, sorry to Ori, you know.
She's used to it by now, but I don't want her to get too used to it.
Yeah. Thank you for joining us today on the Doctor's Corner podcast. We had an amazing episode with Dr. Mela where we spoke everything corporate medicine. Don't forget to like, comment, and subscribe. If you have any questions, if you want to add on what we spoke about, write it on our comment section. We will interact, we'll answer questions that we can. If you want to send us like private messages, you can always DM us and we'll give you the answers that you need, or we can help you wherever we can. And I am still your favorite host, Dr. Dakalo, your favorite village girl. Thank you.